cloud. Hi everyone, this is Ricky Spencer for the Sociology of Media Voices series. Today we're going to speak to someone who might be confronting for some people to talk about, but it's actually a very important thing we need to kind of discuss in a forum. And as you will take this journey through the next 15 to 20 minutes, I just want you to consider all your people around you that care and love you, and we'll give you some support services to contact if there are any issues that may trigger you. I would like the opportunity now to welcome Sue Murray. She is an Order of Australia Medal recipient. She's also a pioneer in many ways in creating a visual space in visibility for suicide. Welcome.
Prevention.
Suicide prevention.
Yeah.
Welcome, Sue.
Thank you very much.
So tell us a little bit about yourself, Sue.
So I think I'm very fortunate to be working in this area. I think my overall passion is about keeping well people well. And I had the opportunity for many years to work in cancer control, and specifically in breast cancer control and breast cancer research. And I learned during that time that one of my strengths is also about building things, not running big organizations, but taking something that is a germ of an idea and turning it into something that is a true and viable option. And I came to suicide prevention more by happenstance than by good management. And it's very interesting. It's something that fulfills that passion of wanting to keep well people well, because you want to prevent anyone from going down that path that might lead to suicide. But I also found that I came into this area at a time when the community discussion around suicide, well, mental health more so, I think, first, but suicide prevention was just starting to increase in the community's sort of dialogue. And one of the things that I particularly noted, which gave me, I think, a lot of motivation to feel that we could really make a difference in relation to the prevention of suicide, was that I found a lot of similarities between where we were, say, in 2012, 2013, with suicide prevention, is where we were in cancer control 20, 25 years beforehand. So I sort of thought we've done so much in terms of raising community awareness, building consumer participation in cancer, in breast cancer, and generally in cancer control. Why can't we apply what we learned there to suicide and its prevention? And that stood me, I think, in very good stead to give me confidence that we were going to be able to make some sort of a difference.
Fabulous. And now tell me a little bit about the Zero Suicide Institute.
Yeah, so my interest in the Zero Suicide framework, healthcare framework, came when I had the opportunity to attend a global meeting in the US in 2015, I think it was. And what struck me was we were trying to do so much in Australia in many, many different avenues to reduce the rates of suicide and to improve the way in which people's suicidality was being managed. But at this meeting, it struck me that the focus was on healthcare. And one thing about the healthcare system is that we have a thing called Medicare. And that means when someone comes into the healthcare system, we actually know who they are. And so I thought, here is an avenue by which we can make some really significant advances in the prevention of suicide, certainly not everywhere, but within a defined environment. And so I felt that this was something where we could really make some advances. And in that area, if I could concentrate on the healthcare system, then a lot of other people could concentrate on the wider environment and the community-based initiatives. Organisations like Beyond Blue, Lifeline, Standby, Are You OK? These are all large organisations that can work at that community level. And so I found that honing in on the healthcare system, where unfortunately we know that around 20% of suicides are people who have been in our healthcare system. So knowing who they are, knowing what pathway they've been through the healthcare system, and then ensuring that they are connected into community-based services to wrap around them and keep them safe, that to me was a way in which we could really, harness some, harness the expertise that's already within the system, and also hopefully make a difference for the people who were presenting to the healthcare system.
And with your work, is there still a stigma around suicide?
Look, I think from the work that the National Mental Health Commission has done, there is very definitely stigma. And stigma exists in a number of different ways. It may be for the individual not wanting to present to somewhere with feelings of suicidality because they feel that a sense of shame or a sense of inability to be able to manage their situation and therefore think something poorly of themselves. There's also, social stigma when people are in workplaces, or if there are differences between groups within society, and the fact that people may have opinions about those individuals that are unjustified and unwarranted, but it presents a stigma. And then there's also, I guess, the structural stigma that exists, where organisations are not putting in place appropriate policies and services and programs that are designed to welcome, in a sense, people into a service so that they feel a sense of comfort and they feel a sense of this service, I belong within this service because it is meeting my needs. So those structural barriers are also a form of stigma.
So what do you see is the role of the media in terms of suicide reporting?
Yeah, so the media has a very important role, and the Mindframe guidelines have been around for many years now, and Australia was at the forefront of producing those guidelines and also supporting the media industry to understand how to apply the guidelines and how to report safely around suicide. And it's been a long journey, but Australia is certainly considered globally to be a leader in that area of media reporting, safe media reporting around suicide, because we have the Mindframe guidelines. And those guidelines have been expanded out now. They are also looking at script writing. So Mindframe is called upon to help look at scripts and make sure that if there is a mental illness or a suicidal script drama that's in the script, then Mindframe is called upon to help ensure that that's done in a safe and responsible way. And so really, I think the media has a great opportunity maintaining those guidelines, but speaking up about suicide, getting it high on the public agenda, helping people feel comfortable. Like, I go back to my breast cancer days, and when, you know, women would have a diagnosis of breast cancer and, you know, they didn't want to tell anyone. They might have a mastectomy, and their partners would not want to talk about it because it would be embarrassing for, they thought, for their partner, or the people that they were talking to. And look at it today. I mean, we walk down the street with bras on the outside of our shirts talking about breast cancer, you know, and the media helped to create that sort of community spirit, community language. And that's why I think we can do so much with suicide and its prevention, because, and we can use the media to help that and to make sure we get accurate information out to the community.
And Sue, can I ask you now, one of the growing trends, well, it's one of the issues that have come up in the use of now digital media, and then the use of some apps in which young people were bullied. What is your sort of take on that? How do we navigate that?
Yes, that's a very good question, because there is also a great lot of good that can come from the online environment. You know, the work that Origin has done with ChatSafe, again, picked up globally, coming out of Australia, how to chat online safely and responsibly. But of course, there is the other side, as you say, that it can be very damaging. It's a question that I don't have a good answer for, but I think it is important to understand we must not demonize the ability for online support to be able to help our young people and help their parents as well. Reachout.com, and, you know, the wonderful resources that it has, not just for young people, but for teachers, health professionals, and also for families. So there is a lot that we can do in a positive sense in the online environment. We just really need to help our young people learn how to navigate those safe environments and stay away from the unsafe environments, and feel that it's okay to go offline. You know, it seems like I'm not a young person, and even I spend a lot of time online in any one day between various social media platforms and keeping up with you know, global commentary around suicide and its prevention. So I can imagine what it's like for young people who really their lives are focused around social media.
And if people are listening, Sue, and they feel somehow that they might have a loved one that they're concerned about, or somebody who has made an attempt in the past, where can they go for some help if they want to get some support around the issue of how best they can support that person?
Yes, well, certainly first and foremost, we recommend people do speak with their GP, so that if needs be, they can get an appropriate transfer of service. They can get a mental health plan put into place for them. But in the immediate, of course, there's always Lifeline, 13 11 14. And then there's the suicide callback service. And that's a service that is run out of On the Line. And suicide callback service means that you can connect with a health professional by phone or on video, and you can go back to them again. So it's not that they'll call you back, it's that you can keep going back as you need. And then, as I've mentioned, there's the online environments with reachout.com, Origin's ChatSafe, Lifelines chat line. Are You OK has got some terrific resources for families and communities to be able to start that conversation. And very often people feel hesitant to actually ask the question, are you feeling suicidal? Do you have a plan to take your own life? Those questions can take away a huge burden from the person because it gives them license to be able to speak to you. And really, we often say you just need to be able to listen with an open heart and an open mind. And that can be the best form of support for someone who is in a suicidal crisis at that moment. And get through that moment just by sitting and being with them and calming. And when that passes, because it will pass, then there's the opportunity to get to your health professional.
And I like the name, Zero Suicide Institute. Is that where you hope to see the future?
Of course.
Zero?
Of course. I think everyone who works in suicide is there, suicide prevention, I should say, is there because we want to see no more suicides. But I think it's also important to understand that this is about a mindset. Zero suicide healthcare is about a continuous quality improvement approach to the way in which people who present to healthcare services are received, managed, treated, supported, and then discharged into those community wraparound services to keep them safe. And all within that, ensuring that the family is supported with education to be able to understand what they can do to keep that individual safe.
And if people want to know more about what the work or the framework of Zero Suicide Institute, is there a web address that people could look at?
Yes, so visit us at zerosuicide.com.au.
That's wonderful. Sue Murray, it has been an absolute pleasure speaking with you today for your wonderful pioneering work in something that we need to discuss with everyone at home, I guess, everywhere. We need to know that there is services that can support to prevent suicide from occurring. And anyone who's feeling at all triggered by this will have resources at the bottom that you can contact. Sue Murray, it has been a wonderful privilege to speak to you, and thank you for giving a voice to those that need a voice.
And thank you so much for the opportunity, Ricky.